I've been lucky because I've been invited to participate in many events organized by Santen on education, on dry eye and allergy as well, mostly dry eye so far. Um, it's been a good program. I had a chance to get in touch with doctors for all over the world, from Asia to United States, South America, and of course Europe. And this gave me a good opportunity not only to deliver my message and my thought on treatment on dry eye allergy and other diseases, but also to get feedback from colleagues and doctors from different parts of the world, which is very nice and helpful for me too, because you do not only try to educate, but also to exchange opportunities, exchange thoughts on treatment and benefits for our patients. So we have already the chance to deliver the message on the use of cyclosporin for the treatment of dry eye disease, particularly in severe patients. The message today, or the main message today, is that you can use cyclosporin pretty safely in the long term. And looks like if you use cyclosporin for at least 1 year, you have a better chance to modify the course of the disease. We know that dry eye disease, especially those severe cases, are chronic patients, and so they never get better. So they have a chance to get worse than get better. So if you have a treatment that can modify and the patient have a good chance to improve the quality of life, not just the condition of the ocular surface, uh, it's a, it's a good message, good results for the treatment of severe patients. Well, thank you, because we have been using cyclosporin for, I would say, 35 years. We were, I think, one of the first group to introduce cyclosporin as a galenic preparation, with the indication, at least that the first one we had was the vernal keratoconjunctivitis. Our publication is 1990, so a long time ago. That means we treat a patient even before the 1990. Uh, and I had the chance to use cyclosporin in different formulation, galenic, other formulation that have been in the market, not in Europe but in other countries. So I had the feeling and the chance to compare the different formulation and different composition and different concentration of cyclosporin. We know that cyclosporin burns all the time, so there is no chance that the patient do not feel the sensation where they put cyclosporin on the ocular surface. But the IKERVIS, which is the European formulation that has been approved in 2015 from the European Agency for severe dry eye patient, is pretty well tolerated. Um, is tolerated in dry eye patient, but it's mostly tolerated in vernal keratoconjunctivitis. So those patients that have severe inflammation, which is completely different from the inflammation you have in dry eye, they even tolerate better IKERVIS or cyclosporin 0.1%. Will have a different name for this indication, but they 4 times a day they tolerate very well cyclosporin for the treatment of a severe inflammation. So the experience is very good with IKERVIS. It's unidose, which is a great advantage compared to the galenic formulation that has no control on quality of the product. It's safe and well tolerated. Great product. So today we're going to have a symposium at SOE dedicated on the long-term treatment of dry eye disease. There will be case presentation from other colleagues. There will be a presentation on long-term treatment with artificial tear substitutes, and other products that you can use for the treatment of dry eye. And I will present data on the long-term use of cyclosporin, IKERVIS in particular, for the treatment of severe patients that have been already treated previously with cyclosporin. So those patients that have been treated at least for 12 months have a good chance to maintain a stable condition of dry eye even without using cyclosporin, but at least you have to use it for at least 1 year to have a good chance. Those patients that have a relapse of the disease, that can happen because this is a chronic disease, you can use cyclosporin again for an extensive time without having any problem. So you can stop and go, and you can do it for long term, because it's a safe product and really helpful for the patients.